and a very warm welcome to our special session, Shingles, the Disease, Impact and Prevention, brought to you by Network 18. Immunization has been instrumental in reducing the incidence of many serious diseases worldwide, including smallpox, polio, measles, and rubella, among others. And we thankfully live in times when we have very developed immunization programs that safeguard us against infectious diseases, such as even shingles now. Yes, today we are here to discuss a very painful disease called shingles, a discussion that will be helpful for adults 50 years and above. And we are joined today by an expert in the field of medicine, Dr. Kaleem Khan, to walk us through shingles, the disease, its impact, and prevention. And before I start, let me tell you a little more about him. Dr. Khan is a consultant dermatologist practicing in Mumbai for over 14 years. He has received formal training at the National Skin Center, Singapore, and completed a fellowship at the University of Toronto, Canada. He has 14 publications in index journals and has contributed chapters in 4 books. Welcome, Dr. Khan. So what is shingles? Well, to be very honest, doctor, and our viewers as well, until recently, I wasn't aware of what shingles is. In fact, I had seen a few awareness drives in the newspapers and digital platforms. And then me and my friends in our family circles, we started talking and we saw this video that I'm going to play for you right now and then get into the discussion.
जरा ध्यान से सुनिए। जब आपके अपनों को शिंगल्स के दर्द से यानी बहुत सारी कीलों की चुभन जैसे दर्द से रोज गुजरना पड़े या फिर असहनीय जलन या बिजली के झटकों की तरह दर्द हर पल सहना पड़े तो दर्द तो आपको भी होगा, है कि नहीं? शिंगल्स का दर्द हफ्तों या महीनों तक रह सकता है और रोजमर्रा की जिंदगी पर रोक लगा सकता है।
50 या उससे अधिक उम्र वाले 90% एडल्ट्स में शिंगल्स का वायरस पहले से ही मौजूद होता है और हर 3 व्यक्ति में से 1 को शिंगल्स हो सकता है। पर अब वैक्सीनेशन द्वारा अपनों को शिंगल्स से बचाना संभव है।
सुना आपने? तो शिंगल्स और उससे बचने के बारे में आज ही अपने डॉक्टर की सलाह लीजिए।
So yeah, in fact, I got reading and I started talking to others about it. And then when I got this opportunity, doctor, I sort of jumped in and said that, yes, let's find out about shingles and who best to speak to you. Please do tell us, what is shingles and why is it that a lot of people are unaware of it?
Right. So shingles is, in the medical terminology, it is herpes zoster, right? And in the lay terminology, it is also known as Nagin. So although people know what it is, they don't know what it is called. And sometimes you only get to know about it when you have suffered or somebody close to you has suffered. So what exactly is shingles or herpes zoster? It is the reactivation of the chickenpox virus or the zoster virus. So what that means is that once you've had chickenpox in your life, that virus or that infection stays in you and it is lying dormant in your cells, and whenever the immune system is unable to keep it under check, it gets reactivated and it comes out on the skin as herpes zoster. So obviously a prerequisite is that somebody who has been having chickenpox or had chickenpox or exposed to the chickenpox virus will get it. Many times we are not even aware whether we have had chickenpox or no. You know, sometimes it's from some obscure rash that we had during childhood days, that colloquially somebody says Mata or Devi, or some rash that had happened in the childhood, that in fact may be chickenpox and you've been exposed to the virus. So the reactivation of this virus, which is lying dormant in your body along a nerve where it comes, is what is herpes zoster or shingles. So it can come along any part of the body, you know, it can come anywhere. It can come on the face, it can come on the body, it can come on the arms, on legs, anywhere. And how does one know whether you have shingles or no? It has a very distinctive look. It comes as small bubbles which are in a very linear pattern distribution, almost like a stripe along one part of the body. So it can come, if it comes on the face, it can come along the eye, it can come on some other part of the face. If it comes on the chest, some people feel that they're getting a heart attack. If you get it on the lower back, some people feel that they're having sciatica or nerve pain. So depending upon where it is involved, you might get the presentation of that. And the single most important thing that people go through when they get herpes zoster or shingles is the pain. And that's exactly what I think even Dr. Amitabh Bachchan was trying to show in his advertisement campaign, that pain can be so disabling to these patients, because if you understand, the virus comes along the nerve. So the nerve pain is always the most disturbing pain and has been described in many ways as burning pain, pricking pain, sometimes like say current passing through a nerve, something like that. So it can be very disabling, yes. And it is not uncommon. Huh? One might assume that, oh, I've not heard of it, it must not be very common, but you'll be surprised that since the immune system weakens once you grow older, it is much more common in older individuals.
Right. Right. Doctor, that puts me in a place to ask you the next question, which is often related with age. Is it specific to a certain age? Who is at high risk of it? How common is it? So those are the questions that get asked often.
Sure. Right. So what happens is that as you grow older, your immune system starts becoming a little weak. I mean, that's common knowledge. And that's also part of something known as immunosenescence, where the immune system is not able to do its job as well as when you were young. So older individuals are at a much higher risk of the reactivation of this virus. Of course, the prerequisite is that you should be exposed to the virus to begin with. So anybody who's not had chickenpox but is in close proximity with someone who has had chickenpox or shingles can get it later on. And older individuals beyond the age of 50 already have been exposed to the virus. So because of low immunity, you are at a much higher risk. I would say that, like it was, I think, we even mentioned in the advertisement campaign, that 1 in 3 may be at a risk of developing shingles or herpes zoster beyond the age of 50. So it is fairly common, yes.
Right, and what are the complications that can come up with shingles?
I think the single most important complication would be the pain, right? Because it involves the nerve and there's nerve damage, there is that unbearable pain which is described by so many ways, but it's still never enough. You know, the burning pain or the pulling pain, the nerve pain, which can be like a pricking pain. So pain is of course an important complication, but if it starts affecting a certain part of the body, like I mentioned, it can come on the face, and if it's on the face, it can come on the eye, which is also known as herpes zoster ophthalmicus. So eye involvement and eye complications can be dangerous, right? So you can have sometimes double vision because of the eye involvement, and very rarely it's not very common, thankfully. But at the same time, it has been described that you can have some optic nerve damage, retina damage, and some blindness too. So these are some dreaded complications of herpes zoster depending upon where it comes.
Right, and before I put the next question to you, I should also ask my viewers that if any one of you has questions related with shingles, please do write in, and we will take all of these questions with doctors with due course of the program. I'm going to make sure I ask all the questions that are on your mind, but I would like it if you had any specific questions to put to doctor. All right, Dr. Khan, when we talk about prevention, when we talk about the course of the infection itself, there are two questions. So you can answer them separately. That, you know, what is the prognosis like? How long does it last? And also, how can one prevent?
Right. So why does this happen? We discussed that it happens because of dip in the immune system, and the reactivation of the virus ends up giving you the shingles or the herpes zoster. So of course, if you want to prevent this problem, you want to make sure that your immune system is doing its job well. As you grow older, the immune system gets weaker, and that's exactly where a vaccination to boost the immune response would come into the picture. Right? So if you take a vaccine and helps your immune system to stay strong, then you can kind of prevent it. And why would you want to prevent it? Of course, because you want to avoid the complication of pain and other things. For the most part, you would probably recover from the herpes zoster pain and the rash in about a month's time, 4 to 6 weeks. But sometimes the pain can persist way beyond 6 weeks also, where it becomes part of something called as post-herpetic neuralgia. And this can be very disabling. So imagine that same pain that one was experiencing in the first 2, 3, 4 weeks of the zoster persisting beyond for months or even years. So post-herpetic neuralgia is a very dreaded complication, and it can happen over a period of time too. So the best treatment for herpes zoster would be to prevent the herpes zoster.
Right. What are the different ways in which one can protect not just themselves, but also the vulnerable family members that are perhaps older than 50, as we just spoke about? What are some of the ways that we can protect ourselves, other than, of course, watching our immunity systems and being and building that immunity? I think post-COVID, everybody has been building immunity and having everything that boosts your system. But really, what are some of the other ways in which we can protect our families?
Yeah, that's a very good question, Mugdha. And at first, you've already answered half of it, where the single most important thing would be to make sure that your immune system is working fine and it's doing its job well. But as you grow older, it becomes part of the aging process where the immune system is not functioning as well. So to keep it up to date, to keep it say robust enough to prevent the infection, would be to boost it by doing vaccination, and that is what adult vaccination is about. And the other basic would be that, of course, you want to avoid exposure to the virus itself, right? The causative organism is the herpes zoster virus or the chicken pox or the varicella zoster virus, right? So you want to avoid exposure to this itself in the first place. But like I mentioned, we are exposed to it in some way or the other during our entire childhood and young adult life. So that is something difficult. But if you can keep your immune system good by taking vaccination, what adult vaccination is about, I think that is the most important thing. Most important thing would be that.
Yeah, a lot of times we do see that when you are younger, you take a lot of, you actually take care a lot of people who are younger in your family with vis-a-vis vaccinations or vis-a-vis how they are how they're protecting themselves. But when people start to get older, that is the time when you have to be much more careful as a caregiver.
Correct. I think that's exactly what you were getting at. Yeah, perfect. I think, Mugdha, that's a very important point that you raised today. What is the role of the caregiver, and what is caregiver stress? So all our lives, our parents have taken care of ourselves as children. And when you grow older, and when the children become adults, they start taking care of the parents, and they now become the caregivers. And you would want the best for your parents, right? So as a caregiver, you would want that your elderly parents are in a good health, they are devoid of pain and discomfort, and the quality of life is better. And as a caregiver, the few things that you can do to improve their life would be to make sure that they have their medication on time, they are in good health, their nutrition is good. And part of that would be to regularly give them the necessary vaccines as you grow older. So there are other vaccines, like the flu vaccines and some other important things that you can give them. So as a caregiver, regular immunization, regular medication, health checkups, giving nutrition is part of what you would want to do for your elderly population. So I think that's a very important thing. And that's a good way that you can also be a part of this overall health of the family.
Doctor, why is there so much stress on vaccination needed for elderly, and how does it work differently for them?
Right. So there is this concept of immunosenescence, right? So as you grow older, the immune system is not as functioning and as active as it was when you were younger. So although vaccination is something that people associate with childhood and children and newborns, but the concept is exactly the same. The vaccine is something that helps to boost your immunity. It's to make your immunity more robust and strong. So, like how you would exercise and do yoga to make your muscles and physical strength strong, like that, vaccines are something that help to make your immune system strong. So, the vaccination is based on a very similar concept to what happens when you have a natural infection in the wild. So, suppose you pick up an infection, the body mounts an immune response, fights it out. What vaccination does is that you take the same infection which is in the wild, the germ, whatever it is, and you introduce it to the system, but in a very controlled manner. So either you use a very small amount, or you only use a part of the germ, or you only use something which is similar to the germ. And then you expose the body to it, the body recognizes it, and then hosts an immune response and keeps it in the memory. That's the whole basis of vaccination. So we are exposing the body to a very controlled amount of the virus or the germ or the infection bacteria, and help the body to recognize when the infection happens in the future, the body is already aware of it and is able to fight it. So that's the whole premise of vaccination. So just like vaccination in childhood is given so that you're able to fight off anything when the immune system is still very immature, the same way on the other end of the spectrum, when you are older and the immune system has become weak, which is immunosenescence, by giving vaccination, you make sure that the immune system remains strong and is able to fight off this infection, which can be very disabling. So I think adult vaccination is not a concept which is very openly discussed or very commonly talked about, but more and more people are realizing the need for vaccination in the elderly and in the adult population post-COVID and post-flu and influenza. I think it is becoming more common, and rightly so, it should.
I always think that we talk about the vulnerable groups, which is the very young, and then, of course, the ones above 50, or in this case, even older people. But shingles does come in the way of regular work. Imagine somebody who is working and has to go to work, has to travel, and then to be saddled with something which can last up to 3-4 weeks can be actually quite compromising. So I think it's not just the very young and the very old who are at stake. I think it's everybody who is working, because it actually comes in the way of doing a lot of things. Because I believe that there are people who cannot even operate with that kind of pain on the body. Is that true, doctor?
So well said, Mugdha. Actually, as a dermatologist, most patients who get herpes zoster or shingles, they would probably come to a dermatologist like me because it's a skin rash. And we see this quite often. And I can most definitely tell you that it is so disabling that people lose their sleep. They cannot even lie down on one side. They are unable to focus on any work that they are doing. So if you are a working individual and you end up getting shingles or zoster, I can almost assure you that you will not be going to work. So it can be very disabling, and the pain is enough to disturb your quality of life and your day-to-day activities. So work is hampered, your sleeping is hampered, you will probably not want to do anything as a group or as part of your family. You should not be also, because it is infectious to begin with, but you probably won't want to do it yourself. So it's a very disabling condition. And if it happens in the younger population, the more adult population rather than the older population, then yes, you are going to take days off work. And if it persists beyond 3 to 4 weeks, like you end up getting post-herpetic neuralgia, then it's a very difficult situation.
In fact, let me tell our viewers that one can find more information about shingles at myvaccinationhub.in. That's not just the only website where you can find information. Any credible website that talks about vaccinations, you can find information about shingles there as well. Doctor, we have now some questions coming from our viewers, and one of them has asked, Sonali is her name, and she has asked, although you've answered this question, but yeah, maybe we can go over it again. Is it contagious? And if it is contagious, how can one prevent it while you are at home with others in the family?
Right. Hi, Sonali. Thanks for joining in. And let's answer that question. So, is it contagious? Yes, of course, it is contagious because it's a virus infection, right? And how would one prevent it? So, I'm assuming this is two-part question where if you have the zoster, how will you prevent it from spreading to other people? So, obviously, you would want to be isolated at home because you are contagious to other people. And to actually prevent it, you obviously, the other part of the question would be that you would want to avoid being in contact with anyone who has active herpes zoster or chickenpox for that matter, because they're both the same virus. So yes, it is contagious, and ideally home isolation till the treatment is complete is what is strongly recommended.
All right. Then we have a question from Pinaz, and she is asking, what are the first signs to confirm that it is shingles?
So, Pinas, the diagnosis of shingles is mostly clinical, is what the dermatologist or your treating physician would be able to see. But there are some other ways to also confirm. You can do some tests. There are some blood tests, but there are also some swabs that you can do to confirm that it is herpes zoster. But for the most part, I would say 9 out of 10 times it is a clinical diagnosis, and your doctor should be able to identify it. As a patient, you can probably identify it with the severe pain that is associated with it, and the pain is generally localized to one part of the body, which is the earliest part to show the infection.
We have another question coming in, doctor, which is about how long does the shingles rash last? And if I may add a couple of more questions in it, is that, what is the prognosis like? That, all right, you find the rash on your body at some part of your body. What is the prognosis? Is it same for everybody? How long does it take to completely go away?
Right. So suppose you get shingles, right? So the rash generally tends to persist for 3 to 4 weeks. But if you take treatment for it immediately, then we can reduce that time to about a week, 10 days. For the most common presentation, it comes up as bubbles, water-filled blisters along a line, or in the medical terminology, it's called a dermatome, but it looks like a stripe. And it can range from just water-filled blisters to ulcers to black-colored spots. So it can look quite horrible, and it can have a little different presentation, but your doctor will be able to identify it, your dermatologist would be able to identify it. If untreated, it lasts definitely up to 3 to 4 weeks. If treated initially at the right time, about a week, 10 days. There may be some marks or scars that tend to persist for a little longer time and may take about another 2 months to heal. But yeah, the active blisters will take about 3 weeks untreated, 1 week if treated.
Sometimes these things take a toll on your self-esteem, because you are not just bearing the pain, but the scars can also be very disturbing. How have your patients been? If you can tell us a little more about them when you meet them. I think one of their major stress points would be that how long will the scars take to go away?
Right. So that is a question of concern. For the most part, during the active infection, the pain is unbearable. So I think they are not focused on how the rash is looking. But once the pain is elevated with the treatment, then the scars and the marks do come into how long will this take, and will this go away? Is it permanent? So thankfully, it is not permanent. And depending upon how severe was the rash, it can take a few months, a couple of months to go away. But it is disturbing. For the most part, it is reminding them of that very difficult time that they went through, the pain and the discomfort that they had. I think that is very disturbing for them. Thankfully, it does go away completely after about 2 to 3 months.
One of the other questions that is coming in is can shingles reoccur? If I have had it once, will I have it once again?
Yeah, that's an excellent question. And although for the most part you don't get it occurring very frequently, so once or twice in a lifetime, but there is a particular group of individuals who can have it more often, and that is something which we didn't discuss in the prior discussions. Was people with comorbidities. Comorbidities are conditions that are existing in that individual. There can be more than one comorbidity, and an example of a comorbidity would be if you have diabetes, or if you have cardiovascular risks, or if you have, say, high cholesterol, you are obese. So, comorbidities can actually predispose you to getting the infection again. So, diabetics are at a much higher risk of having repeated attacks. People who are on medications for 2 or 3 conditions, like almost 50% of the elderly population, they are on polypharmacy where they're taking medication for blood pressure, for heart, for cholesterol, for thyroid. So once you have all of these pre-existing conditions along with older age group, then the risk of getting the infection again, getting shingles again, getting the zoster attack again is much higher. So yes, shingles can reoccur, and if you have underlying comorbidities, the risk of reoccurrence is much higher.
Well, doctor, some older family members will always give you a counter that these are foreign bodies that you're injecting in the system. What is the requirement of it? What is your answer for them?
Yeah, I know that is something that we have to go back and forth, and that is the whole concept of vaccination. And people feel that why should we introduce something foreign into our body? For them, I would say that the whole concept of vaccination is to boost your immunity, right? It is just like stimulating an immune response, how you would get in a natural infection. We are just doing the exact same thing in a very controlled environment. So we are able to say stimulate exactly what we want, improve the immune response, and thereby prevent the infection. If you were to consider the risk and the fact that you have herpes zoster pain versus a vaccine that's going to prevent that pain, I would say that it makes more sense to just take the vaccine, build your immune system, and fight it the correct way rather than suffer through the pain and the discomfort of herpes zoster.
Dr. Khan, there is one question which is coming up very commonly on all platforms, which is on the specific definition of herpes. Now, a lot of people think that herpes is a sexually transmitted infection, and a lot of them then feel that I'm not at risk. Why would it happen to me? But I think that clarification has to be made here that the herpes that we are talking about is totally different than the one that they are talking about, right?
Right. So that's where some of the confusion comes in because they have the same name. It's herpes. And that's because they belong to the same family. There's a herpes viridae family. That's the herpes virus. There are about 8 types. The first 2 are herpes simplex, which people know as the coming on the lips as fever blisters or cold sore. And the one that occurs on the genital, which is sexually transmitted, is herpes simplex 2 or herpes genitalis. What we are talking today is herpes zoster, which is a completely different virus. It's part of the same family, that's why it's called herpes. But this is herpes zoster or varicella zoster. So varicella is the medical name for chickenpox, and this is the same virus that gives rise to chickenpox. This is not sexually transmitted. This is a completely different virus. So don't mistake one herpes with the other. And anyone can get this one, can get shingles or herpes zoster who has had chickenpox. This is not sexually transmitted. This is actually transmitted by droplet infections or in close contact or proximity.
So the next question is, well, how common is this variant of shingles, and is the treatment for shingles lifelong?
Okay, so how common is it? Like I said, it is much more common in the older age group, but as a clinician, as somebody who sees patients, it is something which I'm seeing now in the younger individuals also. In fact, just last week, I had a young 27-year-old girl with herpes zoster ophthalmicus. Right? So that's unusual for somebody to get at this age group, but it is becoming more and more common. Treatment for herpes zoster or shingles? No, you just have to treat that episode and it takes care of the problem. But what happens when it recurs again? How frequently is it going to recur again? Is that in our control? No. So that's where the role of immunization, improving your immune system to fight it off, so that you can keep the virus in a dormant state for a much longer period of time.
You spoke of a young patient, and there is, I think, a young person as one of the viewers and on the platform who's asking, can stress and lifestyle factors attribute towards shingles outbreak?
Absolutely, it does. Absolutely. So why would the immune system in a young individual dip down? So as you grow older, like we discussed, immunosenescence sets in where the immune system starts becoming a little weak and automatically it predisposes you to get the infection. That's why people above the age of 50 should get the vaccination done, because it's more common in them. But what about younger individuals? Why does the immune system in the younger individuals start failing them? I think it's because of today's stressful lifestyle, the poor nutrition, the eating, sleeping habits. A lot of it plays an important role. But some of it is not in our control, some of it is. So that's why there is definitely a holistic treatment that is required to boost the immune response, to lead a healthy lifestyle, to prevent a dip in the immune system. So a combination of a healthy lifestyle, regular vaccination, I think all of that goes hand in hand in preventing this shingles or herpes zoster.
An interesting question is here, which occurred to me as well, which is that we are talking about this infection in relation with chickenpox. Now, there are a lot of people like me, older, when we were young, we had chickenpox. In fact, I remember all my cousins had chickenpox, and we were just thrown in, and every child in the family had chickenpox.
Yeah,
but consecutively, life moved on, and now with the immunization programs, etc. My son, for instance, thankfully has never had chickenpox. They are protected against so many diseases and infections now because of a robust immunization system. Having said that, someone who hasn't had chickenpox, is it a guarantee ki inko to nahi hoga? Or chickenpox, if you haven't had chickenpox, you still can get shingles?
Okay, so of course, if you've never had chickenpox, you are not going to get herpes zoster or shingles, because that's a basic requirement for shingles. You need to have had chickenpox in your system to get shingles. But sometimes we don't know whether we've had chickenpox or no, and sometimes we have just been exposed to the virus and not had physical manifestation of the disease, right? So if you have, like you mentioned, vaccinated your children for chickenpox, correct? But what is the chickenpox vaccine? The chickenpox vaccine is actually the chickenpox virus giving you that immunity to fight it off. That's why you never get chickenpox. But that also introduces the chickenpox in you, right? So if you had the chickenpox, which is a live vaccination, you have the virus in you. And sometimes you're just exposed to the chickenpox virus, it's in you, but you've never had the chickenpox. So you'll never know. So it's best to assume that you have been exposed to the chickenpox virus and that you are at risk of developing zoster. But if you want to ask me, categorically, if you've never had chickenpox before and the chickenpox is not in your system, then yes, you will never get shingles.
Interesting you say that, because I remember when I was young, I had something which looked like a mix of chickenpox and rubella. So
That's
we were
fine.
all confused as to
Yes.
what it was. It could not qualify as being this or that.
Correct.
And I used to think it would happen to young people, but I had somebody in the family who had chickenpox in their late 40s. So that was so surprising that
Actually,
sometimes
yeah.
these things happen and they are unexplained.
Yeah. So adult chickenpox is something that I'm seeing more often now, and probably because for us, maybe in the tier one cities, the immunization program is a little more, say, emphasized upon, and we've all had either the chickenpox vaccine or we have had chickenpox by way of spread. Like you said, everyone in the family had chickenpox. But if you go to, say, a little bit in the interiors in tier 2, tier cities where the vaccination program is not as, say, enforced upon, and where you've not been exposed to the virus, then when you grow older and you actually move to the cities or you move to a place where there is a possibility of acquiring the infection, they get chickenpox for the first time. Right? So you are getting adults now with chickenpox. In fact, the other day I had a patient admitted in the hospital who's 65 years old and had chickenpox for the first time. So yes, it is happening now.
All right, we have another question which is coming from somebody who believes that a lot of people in their 50s, they say 50s is the new middle age. So a lot of people in their 50s, they say, I'm fit, I'm fine, I exercise, I regularly do everything. Should I then take a vaccination, or should I take preventive action that we are talking about?
Yeah, that's also a good question. Sometimes we feel we are healthy enough. We feel that we are doing good in terms of our physical strength, but it is the immune system which is bound to degrade over a period of time. It is part of the aging process. So maybe not at 50, but at 60 you're at a higher risk, right? So healthy adults above the age of 50, yes, you can take the vaccine. But if you want to delay it, sure. Because even if you take the vaccine at 80, it is going to help you for the next 10, 15 years at least. And it's all about quality of life, right? You don't want to be bogged down by this pain and discomfort when you have the actual shingles or zoster. So this is one more way of making sure that you are not held back by this infection if you were to get it. So just like how you take vitamins to keep fit, and how you do your exercise to remain in your, top form, how do you make sure that your immune system is in the top form? That's how you would take your vaccines, right? So yes, you can take it. It would be beneficial. But if you feel that you want to delay it, yeah, you can even take it at 60 for that matter.
The only thought that comes to my mind is that this is an infection that comes in the way of life. Now, imagine you're taking a holiday, or you have an important assignment, or you're starting something fresh, and then something like this happens, which actually puts you in a place where you're just tending to yourself and you're handling that kind of pain. I don't think we have heard of any version of shingles which is a milder or a lighter version. I think when they come full blown, right, doctor?
Yeah, absolutely. When they come, it is full blown. So it can only become worse, or it can become, say, much more than what it is. But it's never something mild that you will brush it off. It is going to impair your quality of life, that's for sure. In fact, if I could, I would probably also mention a couple of my patients. They were traveling, elderly couple, not, I won't even say elderly, in their mid 60s, and they were traveling to Dubai, and they had to cut short their trip because one of them ended up getting zoster, and the pain was so unbearable they had to cut short the trip and come back. So absolutely, it's about quality of life and how much it deters you from leading your normal life. So yeah, absolutely. Like you were saying, you absolutely hit the nail on the head. It's about quality of life.
Yeah. In fact, somebody who joined in late is asking us, where can I find more information online if I have to find information? So I think one of the things that I can tell you is myvaccinationhub.in. That is one place that you can find all the necessary information that you need regarding shingles. Any other thing that you suggest, doctor?
No, I think this is a good platform where there is verified and genuine information available. That's the other problem with the internet. Many times you end up getting information which is not verified. So if you stick to either government approved websites or medical websites which have verified the data, I'm good.
I think, doctor, one of the things that people also ask is uh, uh, why when we are talking about the adult population, can this lead to co-occurrence of something else? Can the shingles complication aid to another already existing comorbidity?
Actually, it's the other way. It's the other way. So other comorbidities can make you more predisposed to shingles or herpes. So if you have,
How
like I
so?
discussed earlier, I just
Yes.
discussed a little earlier about how if you have diabetes or if you have blood pressure or if you have thyroid issues, they can make your immune system a little weaker and then predispose you to more reactivation, and that's how you would end up getting the shingles. So it's the other way. Not that shingles makes it worse; it just disturbs your quality of life completely. But other things can increase your chance of getting shingles.
Actually, doctor, pretty much our lives have been divided before pandemic and after pandemic.
True.
I had never heard so many people talk about their immunity before the pandemic, and suddenly after the pandemic everything has become about that. And I've also seen a lot of manifestation of autoimmune disorders among people, where people who have been healthy all their lives are suddenly have compromised immunity. And sometimes you feel if you're healthy, if you're working out, everything is fine, but I've seen some of the fittest people having immunity issues. So I guess one cannot say anything general in a general format about immunity.
Actually, that's a comment slash statement that you have made, which has a lot of ramifications and implications. And as a treating physician, I can absolutely tell you that COVID has done some weird things to the immune system. So, as a dermatologist, I do see patients with a lot of weird autoimmune diseases, autoimmune rashes, which patients didn't have prior to COVID, and post COVID, they are seeing it. In the same vein, the incidence of herpes zoster post COVID has definitely increased much more. In fact, there are some numbers which say that people who have had COVID or had some active disease of COVID, they have at least a 15 to 20% higher risk of getting herpes zoster. And if, God forbid, you had an admission because of your COVID, these patients have at least a 20-25% higher risk of developing herpes zoster. So COVID has opened up a Pandora's box as far as the immune system is concerned, and there is a significantly higher risk of developing autoimmune diseases post-COVID, and herpes zoster is just one of them.
Dr. Khan, any closing comments before we wrap up the show?
I think the most important thing that I would say is that immunity would be one way to make sure that you have a healthy life and an improved quality of life. In whatever way you can improve your immune system, so diet, exercise, yoga, and of course, adult vaccination. Please keep it in mind. And prevention is the best treatment, absolutely. I strongly agree to that.
Well, thank you so much, doctor, for your time, for your valuable
My
time,
pleasure,
for all
my
the
pleasure.
insights.
Thank you. Thank you for all the questions and hosting this so beautifully. Thank you, Mugdha.
Well, with
Okay.
that, it's a wrap,
Yes.
viewers. I hope we have answered all your questions and you are better informed today about shingles, the disease, impact, and prevention. Thank you for watching.